Hi, this is Dr. Doug Willen. Today's video is on the benefits of vitamin D. It's a vitamin in my practice that really makes a difference in how people feel. So from a clinical standpoint, it has a big impact. A lot of people know vitamin D is the sunshine vitamin, and that's because it's produced in your skin in response to sunlight. It's a fat-soluble vitamin in a family of compounds that includes vitamins D1, D2, and D3. Other fat-soluble vitamins would be vitamin A, vitamin E, vitamin K. Water-soluble vitamins would be like B vitamins, C vitamins. Also, a lot of your minerals, calcium, magnesium, are water-soluble, just to give you an idea. Your body produces vitamin D naturally. So when it's directly exposed to sunlight, your body will be making vitamin D. You can also get it through certain foods and supplements to ensure adequate levels of your vitamin D will be in your blood. And as you see, as we go through, you're going to start to see how important vitamin D is because it affects a lot of different areas of the body. Vitamin D has several important functions. It regulates the absorption of calcium and phosphorus, facilitates normal immune system functions. So this is important. Our immune system cannot be at optimal levels if you are getting depleted in vitamin D. So it's not a vitamin that you want to become deficient in. Helps with normal growth and development of bones and teeth. That's one we probably heard about way back in grade school, but vitamin D has a lot more going on than that. It can aid in resistance against certain diseases. Vitamin D fighting disease. Research suggests that vitamin D may also play a role in reducing your risk of multiple sclerosis. I found that interesting. It's interesting to me how far-reaching vitamin D is. Like, if you asked me when I was a kid, I would say, oh, isn't that for your bones? Because TV commercials that I had when I was a little boy would say, drink your milk, you'll get vitamin D. And it would even say on your milk container, fortified with vitamin D. So that association was always there. A lot of people don't know it decreases your chance of developing heart disease. Heart disease is the #1 killer here in the United States number one cause of death is heart disease. So why wouldn't we want to decrease that chance? Helps to reduce your likelihood of developing the flu and also the COVID. So I might do a video just on vitamin D and COVID coming in the next couple of weeks. But in the meantime, or if you're looking at this after the published date, look in my queue. You might see my vitamin D and COVID one because I have that in the works. Vitamin D is great for fatigue and tiredness. So here, look at this case study. I had this, I've been in practice 23 years, and worked a lot with nutrition as well as I'm also a chiropractor. A lot of you know that. But I have had a female nurse, 43 years old, chronic headaches, chronic fatigue, would push herself all day long going to work. She was working in the operating room, where you have these long procedures that she was assisting the surgical team, and you can't just yawn, but she felt like she was always stifling a yawn. We ran blood work on her, and the vitamin D showed 5.4 nanograms per milliliter. That's the measurement that's used. And just to give you an idea, below 20 milligrams is deficient. So she was at a 5.4. I make a vitamin D product. There's a lot of good ones out there. So you really, if you shop around, you will find good vitamin Ds. I'm proud of mine. I made it specifically to impact my patients. But again, I'm not here to tell you that the one you have is wrong. Whatever you feel comfortable with. But anyway, she took my vitamin D, which is a D3K2, and we got her levels up to 36.2, and all her symptoms went away. So she had no more headaches, and the fatigue and stamina and mental acuity was popped right back. And, again, she's not old at 43, but she was at that age and part of her career where she was starting to feel overwhelmed and exhausted all the time. So vitamin D can be very powerful. Vitamin D reduces depression. That's another thing no one knows about with vitamin D. So if you're the type of person that has melancholy or mild to moderate depression, severe depression, I'm not saying it's curing depression, but if I had depression or my loved ones have depression or anyone you know that has depression at any level would benefit to make sure their vitamin D is not in deficiency. So that's what we're talking about. Couple little notes on that. Vitamin D might play an important role in regulating mood and warding off depression. In my specific practice with patients of mine coming in over the years who were depressed, it's really easy just to say, add some vitamin D. Why not? It's not harmful, and it's just a good daily protocol. A lot of people take a daily multiple vitamin. I think in today's world we need a vitamin D also. So they take the vitamin D supplements, and most of them will tell me within a couple of weeks that they see a big change in that specific symptom of fatigue, headache, muscle aches, and we'll talk a little bit more about that as we go through these slides. Patients of mine that have fibromyalgia also report a diminishment of symptoms. Anxiety and depression is also connected sometimes to the fibromyalgia patient, where the fibromyalgia patient says, not only do I have all these aches and pains throughout the body, but it's associated with anxiety and depression. A lot of them, it couples with it. Vitamin D helps with weight loss. I mean, who doesn't like that, right? When they test on this, they give the placebo group and they give the group that actually gets the vitamin D, and they see a difference. And, you know, there more studies need to be done, of course, but this is just curious stuff because we're not talking about a pharmaceutical drug. We're talking about vitamin D, something that you could just put in your diet and give it a shot. The scientists said the extra calcium in the vitamin D had an appetite-suppressing effect. To me, that's interesting because I'm always craving food. You know, I've been a big eater as a kid. I still like eating. So anything that naturally, without being a stimulating effect, like taking too much caffeine or herbs that race you up, vitamin D has a calming, organic, natural appetite-suppressing reaction for many people. So another benefit of vitamin D is muscle pain. Muscle aches and pains may be caused for both children and adults. So you get children that have growing pains. Their parents tell me, their child has achy joints, or their pediatrician told them they're just going through growing pains. Check out their vitamin D levels. Maybe put them on vitamin D and as a trial period for months, see what happens with the child or the adult and see how that feels with that chronic muscle aches and pains. 71% of people with chronic pain were found to be deficient in vitamin D. There you go. Vitamin D receptors are present in nerve cells. That's called the nociceptors, which sense pain. So we have mechanoreceptors and proprioceptors and pain receptors in the tissue joints of the body, and this will help diminish that. Growing pains in children, as I said, could be reduced. Impaired wound healing. So people that don't heal quick. I'm thinking right away people with diabetes, but anybody that heals slowly would benefit from vitamin D. So, slow healing wounds after surgery or injury. So not just infections or cuts, but also spraining an ankle, injuries like that. Hair loss. Now, hair loss, we're not talking about hereditary alopecia like I have, that you're probably laughing right now going, he's got it. And I do take vitamin D. But we're seeing more of an effect on women with hair loss. So the women that are noticing that more hair than they'd like is coming out in the hairbrush or in the drain of this shower as they get into their late 30s, 40s, 50s, 60s. It's not the only piece because it could also be adrenal, it could be a thyroid, it could be diet, it could be toxicity, it could be a lot of different things. It could be female hormone balance, it could be estrogen dominance and progesterone deficiency, other videos that I do on those topics, but put some vitamin D in, see how it does for you. So hair loss women has been linked to low level vitamin D, I just said that. Moving on. Some foods that include vitamin D is any of the fatty fishes like tuna, mackerel, salmon. So get your fish. Fortified foods with vitamin D. So dairy products. I'm not a big fan on too much dairy, but I'm just reporting on where you're going to find the Ds. Orange juice, Again, I'm not a big fan of waking up in the morning and having a big glass of orange juice. I personally don't need that much sugar in that form. But again, I'm reporting where in the world would you find vitamin D other than sunlight, soy milk and cereals, beef liver, cheese, eggs, and specifically the egg yolk. I have a vitamin D product, as I said. This is what my online store looks like. Give it a try if you're interested. But if not, stick with the vitamin D that you're already using. Shop for high-level vitamin Ds. I like the D3 with the K2 because it also not only helps you utilize the calcium, but also help absorb it. But the main thing is to give it a try. Please subscribe if you haven't already, and thank you for your support and encouragement in making these videos. Please leave a comment below. Thank you so much, and we'll talk soon.